Hi, I'm Garvin. This telecast is on Minocin. So, Minocin is a capsule, contains 100 milligram of minocycline, or Minox is a capsule which contains 50 milligram of minocycline. So, minocycline is a broad-spectrum antibiotic used for the treatment of infections caused by tetracycline-sensitive organisms. This drug is used for various reasons, namely acne, ear, nose and throat infections, urinary tract infections, as well as many other types of infection. So for routine antibiotic use, take 200 milligram daily in divided doses. For the treatment of gonorrhea in adult males, it's 200 milligram initially, followed by 100 milligram every 12 hours for a minimum of 4 days, with post-therapy cultures within 2 to 3 days. For adult females, may require therapy for 10 to 14 days at the same dosage indicated for males. For the treatment of acne, it's 50 milligram twice a day. Acne vulgaris is 50 milligram twice a day, and the treatment of acne should be continued for a minimum of 6 weeks and where possible limited to a maximum of 6 months. For treatment above 8 years of age, the recommended dosage of Minocin is 50 milligram tablet every 12 hours. Minocycline is not recommended for children under 8 years of age. Minocycline may be used at the normal recommended dosage in elderly patients, even with mild to moderate renal impairment. Common side effects include dizziness, feeling nausea or diarrhea. Minocycline should not be administered to patients who are hypersensitive to minocycline hydrochloride. Other similar antibiotics such as tetracyclines or doxycycline or any other ingredient in minocycline. This drug must not be taken by patients with systemic lupus erythematosus, with hepatic dysfunction or a history of hepatic dysfunction, with complete kidney failure. And tetracyclines may cause a yellow to brown discoloration of the teeth and enamel in the developing fetus or child, and therefore minocycline should only be administered if considered essential to pregnant or breastfeeding women and to children under 8 years of age. The treatment period should be as short as feasible and repeated courses should be avoided. Minocycline, like other tetracycline class antibiotics, crosses the placenta and may cause fetal harm when administered to a pregnant woman. Permanent tooth discoloration may occur in the developing infant. Minocycline should only be administered to pregnant and breastfeeding women if considered essential by your doctor. The concomitant use of tetracyclines may reduce the efficacy of oral contraceptives. Patients taking oral contraceptives should be warned that if diarrhea or breakthrough bleeding occur, there is a possibility of contraceptive failure. Patients who experience lightheadedness, dizziness, and vertigo whilst taking minocycline should refrain from driving or operating machinery. Minocycline should not be used by patients sensitive to sunlight or artificial light such as sunbeds. Minocycline can interact with other medicines, so it is important to tell your doctor or pharmacist if you're taking iron salts or antacids. It is recommended that any indigestion remedies, vitamins, or other supplements containing these are taken at least 3 hours before or after a dose of minocycline. This drug should not be used with penicillin or cephalosporin antibiotics, and avoid combined use with kaolin-activated charcoal and ion exchangers. Talk to your doctor if you are taking diuretics, as it may aggravate nephrotoxicity by volume depletion. And minocycline is not significantly impaired by food or moderate amounts of milk. Speak with your doctor if you have liver impairment before taking this medication. Minocycline should be used with caution in patients with hepatic dysfunction and in conjunction with alcohol or other potentially hepatotoxic drugs. So if you have any questions on minocycline, you can contact me through the Life Pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.